This podcast is about mood swings and a few other types of emotions during pregnancy. If you're pregnant, your body is experiencing major change, from symptoms that you might expect to ones that are completely out of the blue. Every woman will have a different pregnancy experience. It's helpful to have an idea of how your body may affect your emotions and feelings. Okay, so let's talk about your feelings and emotions during pregnancy. During pregnancy, you will probably feel many ups and downs. You may experience some or all of these emotions, and they may change quickly. You might experience, the first one is surprise. If your pregnancy is unexpected, you may then feel joy if you welcome the pregnancy, or fear if you are unsure about the change to your life, or both. 2, you might experience happiness, particularly if you have been trying to have a baby and you feel well. 3, anger, which can result from your body's hormonal changes, from a sense of being vulnerable, or from pregnancy symptoms that are uncomfortable or painful. 4, fear for the baby's health. If you have concerns about your baby having an illness or disability. If you are worried about a particular risk, talk to your midwife or doctor. 5, fear of birth, which is a recognized psychological disorder. Counseling and talking with your midwife or doctor can help you overcome this fear. 6, love for your baby, your partner, and your family. 7, sadness or disappointment if you have illness or complications during your pregnancy, or you can't have the birth plan that you would prefer. 8, general sadness about the world, whereby you find it hard to watch the news or hear sad stories about children or families. 9, grief, if you suffer a miscarriage, a loss at a later stage of pregnancy, or a stillbirth. 10, prolonged sadness from perinatal depression. In this case, you'll need the help of health specialists. Okay? Now let's talk about mood swings during pregnancy. The hormones changing in your body mean you will probably have heightened emotions, both positive and negative, and you will probably swing between these emotions. While you may be overjoyed about having a baby, you may also be stressed and overwhelmed. You may feel worried about whether your baby will affect your relationship with your partner. You might be worried that how you will cope financially, or whether you will be able to juggle work and parenting. You might be worried that whether you'll be a good mother, or the baby will be healthy. Or you're worried that your other children will or will not accept and love the new baby. You may also also feel unimpressed with your changing body. You may be worried about putting on too much weight or not enough, or not being able to do the physical activity that you usually do, or not looking attractive to your partner. Add the hormone-induced fatigue, forgetfulness, and moodiness, and you may feel completely out of control. This is all common. Okay? Now let's talk about depression during pregnancy. Some women will have depression or anxiety during pregnancy, and even more will suffer from these conditions after giving birth. Many women don't seek help because they feel embarrassed or guilty about feeling so awful when they're supposed to be happy. But depression is not something that you can control in this way. Because an untreated mental illness can have long-term effects on your health and well-being, and on your baby too, getting the right treatment is vital. Talk to the doctor if you are depressed or miserable for most of the day and on most days, or annoyed, angry, or anxious a lot of the time. You might want to talk to your doctor if you're crying a lot and losing interest in activities that you usually like. Something else you might want to look at is if you're struggling to sleep, even when your baby is sleeping, or sleeping more than usual. Talk to your doctor if you are under or overeating, if you are feeling tired most of the time, if you're not able to concentrate, if you're preoccupied or anxious about things going wrong with your pregnancy, you, your baby, or your partner. If you're feeling that you have not bonded with your baby or that you have no maternal feelings. Feeling guilty or feeling that you are failing as a mother. Or thinking about harming yourself. Thinking it would be better if you or your baby were dead. Or thinking about suicide. Remember, tell someone if you feel depressed because early treatment is the best treatment. Plenty of safe and effective treatments are available for depression during pregnancies and while breastfeeding. But herbal and complementary treatments such as St. John's wort may not be safe in pregnancy. Okay, let's talk about anxiety during pregnancy. You may be feeling quite anxious about your pregnancy and about being a parent. Many pregnant women feel some anxiety, but a few develop an anxiety disorder that needs treatment. Symptoms of an anxiety disorder include constant worry, stress, or nervousness, muscle tension and teeth clenching, not ever feeling calm, not being able to sleep well or for long, or panic attacks. Those would all be symptoms of an anxiety disorder. Other serious issues during pregnancy. Some pregnant women develop mental illnesses that are a significant risk to both them and their child. Other women may already have a mental illness that is more difficult to manage during pregnancy. In particular, specialist health care is needed for pregnant women with 1. Bipolar disorder, of which pregnancy may trigger the first episode with manic highs and depression lows. 2. Schizophrenia. Or 3. Eating disorders, including anorexia nervosa and bulimia nervosa. The risks include a loss of nutrition for your baby, an increase of miscarriage, and anemia. Okay, thank you for listening. Please consider subscribing. Citation betterhealth.vic.gov.au/health/healthy living.